It's time. So let's start. I will introduce first in Japanese. 皆さん、じゃあ、こんにちは。ですね、今日は、塚越ソニア先生をお迎えしてですね、オンラインの特別セミナーをお送りします。塚越先生は、この紹介のチラシでも書いているんですけども、イギリスで、もう長らく、GP、総合診療医として働いておられる先生なんですけども、日本語も少しおできになるんですが、今日はですね、ちょっと、細かいところまで話されるので、ちょっと英語でという、ことになってます。一応、後で、今日のスライドもシェアしますけども、それに日本語の翻訳もですね、つけております。塚越ソニア先生なんですけども、インペリアルカレッジロンドンを卒業されてですね、女性医療とか、更年期医療、ライフスタイル医学、統合医療などを専門とされて、さらにトラウマインフォームドケアというですね、そういうところにも詳しい、患者中心の医療の専門家ですね。それから、総合診療家庭医療の、世界的な組織であるウォンカ、のですね、統合医療分野の国際的リーダーを務めておられます。で、今日は、Human Side of Medicine ということで、医療の人間的側面、それから文化と、文化的背景とか、その辺をですね、特に話される予定なんですけども、この総合診療、家庭医療の日本とイギリスの対比とかですね、医療制度の違い、医療における文化的能力ですね、カルチュラルコンピテンシー、その辺もですね、お話しされると思います。で、今日はこの会が実現したのはですね、今、2年生の小松美優さんが、高校生の時に、もう塚越先生と、というか、塚越先生のレクチャーを聞いて、総合診療いいなと思って、鳥大に来られたというところもありますので、小松さんとですね、話してですね、ソニア先生を今日お招きしました。じゃあ、ソニア先生、よろしくお願いします。
ありがとうございます。ちょっとシェアしますと、あれだ。はい。So thank you very much for the introduction. I'm sorry this is in English. Hopefully one day my Japanese will be much better, that I can do this in Japanese. So my talk is about the UK general practice, and it will be about the UK general practice and culture in healthcare. So, just a little bit about me. I am My parents are Japanese. That's my mum on the left, and that's my brother, and that's me as a baby. I went to school in the UK, and I went to university in the UK as well. So I've always grown up with two cultures. I'm sorry about me trying to figure this out. Okay. So my life in London at the moment. So I live in London with my boyfriend. He is a diplomat and works for the Foreign Office. I work in the public sector in North London as an NHS GP, and I will explain to you what NHS means later. I work there 2 days a week. I work 1 day a week in a private clinic in South Kensington. And as you can see, from the picture, it's much more luxurious than my public sector job. I also work in a team looking after homeless patients. So I do a lot of the service planning for this role. And finally, as Son Sensei mentioned, I teach in a I teach once a year on a program called Double Helix, where I met Komatsu-san a few years ago, where we teach high school students who are interested in applying for medicine. And I'm actually leaving next Wednesday to go back to Japan. So my hobbies and interests, I really love cooking. I probably would I love cooking at home. Um, I love sort of eating. It's very much a passion of mine. I practice a lot of yoga, so I go 3 or 4 times a week, and I have a teacher qualification as well. I absolutely love dogs. We don't have one because I travel too much, but I'm always looking after my friends' dogs. And I love spending times with my international friends. This friend here is a very good friend of mine, and she lives in Ibiza in Spain, and we go to visit once a year. The other thing is, I absolutely love traveling. So I visited 47 countries in total, and I've lived in 6 different countries. So the countries I've lived in was I spent 3 months as a student in Peru, and that's a picture of me with some llamas. Obviously, I've lived in the UK for most of my life. I've worked and lived in Uganda, and that's one of my favorite pictures of my time because they would dry X-ray radiographs outside in the sun. I've lived in Paris as well. I've lived in Japan, in Fukushima. And finally, I lived in China, Beijing, Peking, for 6 months. This was my last trip 2 years ago. As a doctor, as I said, I've been to Peru and Uganda, but I've also worked in India and I've observed healthcare in the USA, Denmark, and Australia. So today, what I want to do is I want to spend some time exploring primary care in the UK. I want to compare this to primary care in Japan, but I want to talk something about that I'm really passionate about, which is about culture and how culture affects the doctor-patient relationship. So the first question, obviously, is what is primary care? So healthcare is separated into primary, secondary, and tertiary care. So primary is the community. So GP clinics are placed in amongst residential areas. You've got the local hospital that you can go to, and then the local hospital can refer you to the specialist hospital as well, and that's your tertiary care. And in the community, we have lots of different services. So we'll have a community, obviously, medical service, but we also have community physio services, and community nurses, and social services as well. So, how does the UK system work? So, previously I mentioned the NHS. This stands for the National Health Service, and this is the public service. And the really important thing to know is that it's totally free for the person using it because the money is taken out at when taken out through your tax. So when a patient comes to see me, there are no co-payments. They don't have to fill out any forms in terms of their insurance either. So it's totally free at the point of contact. The difference with a lot of countries is that all UK citizens have to register with a GP practice, and usually it has to be a local GP. So most GPs will cover an area, and if you live in that area, you can register with that GP practice. And this is really important because it means that they go to the same clinic rather than going to lots of different clinics. When a patient comes to our clinic, they can see different people. So they can see the doctor, the GP, or they can see the nurse, they can see the pharmacist, or the physio. So any problem that you have, the first person you or the first place you go to is your GP clinic. Now we manage lots of conditions ourselves, and sometimes, if it's very complex, we refer to the hospital. Only 10% of the patients that we see need referral to the hospital. And this is really important because we can really make it patient-centered care. So we can place the patient's needs and wants in the middle and then plan their future care around that. Once the patient is referred to the hospital specialist sees the patient and they have to write back to us. So they write a letter explaining what they saw, what they think, and what they want to do. And then when the hospital specialists might see our patients for a few months, maybe a few years, and then once they are finished with their care, they will return the patient back to us. So the nice thing is that we hold all the medical records for the patient from when they have registered with us. So they will have all the hospital letters, all the blood tests, everything recorded in their notes. If they have come from a different clinic to us, those notes will also be sent over to us as well. So we may have all the notes from birth, from when they are born. And this is really important because we can see the history of the patient and we can see what they've had done and what is missing. Hmm, oops. So, okay. So, what is the role of a GP? So, GP is very, very common in the UK. It's a very natural part of our healthcare system. We are so essential that 50% of medical students need to become GPs to cover that space. So, we do a lot of things. So, mostly, we would diagnose and manage common and chronic conditions. So, diabetes, high blood pressure, mental health, eczema, end of life care, etc. What's also really lovely is that we look after patients long term. So, as I said earlier, patients have to come to the one clinic, they can't go to different clinics. So you get to know your patients, and sometimes you'll know a patient, you'll know their mum and dad, you'll know their children, you'll know their brother and sister, because a whole family can be registered at one clinic. We also coordinate the care with specialists and local services. So I might ask the local nurses to visit the patient at home if they're old. I might contact social services if I'm worried about the safety of the children in the house. I might refer them to orthopedics at the hospital, but they may see our local physiotherapist. So I get to coordinate the care a bit like a conductor in an orchestra. And also, we do health promotion and disease prevention as well. So we talk to our patients about stopping smoking, maybe we look at their family history, etc. So this is a typical clinic that I might do. So my clinics start from 8:30 and they finish around just around midday. So we have a mixture of face-to-face appointments and telephone appointments. Our face-to-face appointments are they are 15 minutes and our telephone are 10 minutes. So you can see here in black, it's the face-to-face, and in red is a telephone. So at 8:30, I might have a mental health follow-up, maybe a young person with depression that I might have started medications in. After that, if someone comes in to see me about some knee pain, they will get a double appointment because in London we have a lot of non-English speaking patients. So patients who speak different languages. And we have a telephone interpreter service that we can call and they will interpret for us. In my particular area, we have a lot of patients from Somalia and a lot of patients from South America. But we can literally have any language. Actually, we have quite a few Japanese people as well. So after that, after my double appointment, we I might see an eczema in a 3-year-old. After that, I might see a postnatal 8-week check, so both mother and baby, where the mother has given birth 8 weeks ago. So I'm checking the baby reflexes, the weight, the height, and I'm checking that the mother is okay after the delivery. And then I might have a telephone call about a patient who's worried that they might have ADHD. Then I might talk to a patient about their blood test results. Maybe I'll speak to a patient about a period that they have missed. And these are things where if I feel that I need to examine them, I can book them in for a face-to-face. So after the telephones, we tend to see the same day appointments. So these are the emergency patients. So there might be sinusitis, flu, a baby with a fever, back pain that needs painkillers, and maybe an issue with a pregnancy. We during our lunch break, well, it's not really a lunch break. What we do is that we do all our admin. So we look at all the letters from the hospital specialists. We look at fit notes. So these are letters to say that patients are not well that we give to employers, to the offices that my patients work at, so that they can have time off work. We also complete benefits forms as well. So these are patients who need money from the government because they don't work, and we need to tell them that need to tell the government why they can't work. And then after that is the afternoon. So I might speak to someone about their sexual health and contraception options. Maybe my second appointment is difficulty sleeping and stress at work, family issues, someone who wants genetic testing because their mother has been diagnosed with breast cancer. Maybe it's a blood pressure checkup, child with a who has difficulty walking. And then I have some telephones again. So if my patient has a new diagnosis of cancer, I will often offer them a telephone call with me afterwards, after the hospital appointment. And this is just what we call courtesy. So just to be nice to the patient because they have a very difficult diagnosis, a very emotional diagnosis. And our patients often trust us because we've known them for a really long time. So they will speak to us about and ask us the questions that they couldn't ask at the hospital. We might have to talk about end of life care, discussion with relatives, and maybe it's a telephone call for a scan result. And then again, after that are more emergencies. So a fever in a returning traveller, head injury, infected wound after an operation, constipation in a child, and chest pain. And at the end of the day, I make sure that I reviewed the blood tests for the day and any medications requests from patients that I have issued as well. So you can see from this that it's a very varied day. There's lots of different things, and you never know what's coming through the door. So when you book an appointment at the clinic, you can book with different people. So obviously everyone knows that you can book with a doctor. So we will take on the medical symptoms and the complex cases. Also, you can see from this list here that we have a lot of social problems as well. So family issues or stress at work. And I find it really interesting and really beautiful that patients feel comfortable to talk to me about very personal and private things, and not just medical problems. So they can also book with the nurses. I think that this is very, very unique to the UK, but our nurses are very highly trained. So they have their own separate clinics, where they will do their own travel vaccines, child vaccines, wound care, and a lot of long-term management like diabetes, asthma, and COPD. And they will do all our smear tests as well. And they are an absolute lifesaver when it comes to the clinic. We have physiotherapists as well, so they're very highly trained, senior, experienced physiotherapists, and they tend to do the kind of more complex musculoskeletal problems. We also have incredible pharmacists. So they will do a lot of our medication reviews of our patients and they will monitor contraception, blood pressure, transgender care. So we're looking at estrogen and testosterone replacement and mental health. And we have this lady called Jacqueline, who is a social prescriber, and she is really good. So when patients come to me and they are very stressed and depressed, and it's because they're not sure that they can pay for their house or maybe they're losing their job, I will ask Jacqueline to see them because she is very experienced in housing, finances, loneliness, work-related problems, finding jobs, benefits, etc. So she can spend a lot of time with my patients trying to help their social situation, which will have an impact on their health. So, British primary care is unique because GPs are truly generalists and we are gatekeepers. What that means is that patients have to come and see us, and we only open the gate when to the hospital when it's appropriate. This means that we manage 90% of all the problems that come to us, so that only complex things go to the hospital. We are the first point of contact in the UK health system and is delivered mainly by general practitioners. But in the last 20 years or so, it has expanded to include physios and pharmacists, and I'm sure it will continue to expand. So we're part of a public system, the National Health Service. There is a private system as well, but that's often the insurance comes through work. It's less common, less popular than the NHS. The NHS is the main service. And the beautiful thing about British primary care is that we cover all ages, all conditions, and we go out like, from prevention to chronic disease management. And if we compare this to Japanese primary care, which is a direct to specialist system, so there is no gatekeeping role. And it's delivered by a variety of people, but mainly doctors. So, family medicine doctors or specialists who work in the community. And what I find really interesting is that people can go to different specialists for different problems. Or actually, no, what I find really interesting is that you can go to your orthopedic doctor for a blood pressure problem, which for me sounds very strange because I would manage the blood pressure or I would ask a cardiologist. And I don't know if I would ask an orthopedic surgeons, but I find that very interesting about Japan. Um, I think Japan is based on the health insurance is health insurance based with co-payments. So a huge difference is that no money is used in our interactions or in our consultations. And we cover all ages. So in Japan, you cover all ages, all conditions from prevention to chronic disease as well. The benefits of the UK system, in my opinion, is that it is cost effective. So specialists cost a lot of money. And so if we manage a lot of the problems, then what gets referred to the hospital is what needs to go there. Also, we as GPs, we are trained not to use tests. So we only use blood tests and scans, and we only use them when necessary. So therefore, patients are not overdiagnosed and they are not over-investigated. What I also like about the UK system is that it is equitable and everyone gets the same healthcare. So as I said, the main healthcare system is the public system. So it doesn't matter if you're rich or you're poor, you get the same healthcare. And the other benefit for us is that it's flexible working for doctors. So I can choose how many days I work and what days I work as well. So in the public system, I work 2 days. The difficulties of the UK system, so no system is perfect. We have very, very, very long waiting lists. So if I refer to a specialist, it might take between 6 to 12 months to get an appointment. I can always email and they can always give me advice in advance, but it's a very long waiting list. You cannot choose your appointment time or your dates or which hospital because this is decided on how local you are. So we would refer, from my clinic, we would refer to Whittington Hospital or UCL, and that's it. And sometimes we can try and argue to refer to a different hospital, but often there is not very much choice. There is a lot of administrative error and therefore waste, which is quite annoying. So there are often appointments that the patients don't know about because they didn't receive the letter. And it's a limited job market for doctors. So there's not very many other companies that we can go and work for. If we don't like the NHS, there's not many other alternatives. So I'm going to stop here for a moment. We will cover cultural competence next, but I just wanted to know if there are any questions at this moment.
Thank you, ソニア先生。じゃあ、ここでちょっと中間ですけども、質問の時間を取りたいということで、あの、一応事前にいただいた、アンケートの質問も後で最後にちょっと紹介しようと思うんですけど、どうでしょう。今聞いてて、ちょっとこの辺聞いてみたいなとか思ったのがあれば、どなたでも。小松さんいきますか？うん。
Thank you. I wonder why there are so many errors. Because of the system, maybe.
Mm,
Yeah.
yeah.
Could you please more explanation?
Um, I think the NHS is the biggest employer in the
Mm,
world. So it's the biggest organization.
mm,
And I think there's very little control, maybe. So you'll have one
um,
central administration
mhm,
that sends out all the letters. So
mhm,
there's not very much personalization.
mhm,
If a patient has lost their phone or if they've moved address, then a lot of these letters and appointments go to the wrong place.
mhm,
Also, for example, if this is very common, but the hospital will send an appointment for this day at this time,
mhm,
and the patient will try to call the hospital to change the appointment because maybe they are working, maybe they are on holiday,
mhm.
but then no one answers the phone, or and so the patient can't cancel or change the appointment, and so they don't go. And
See.
obviously that's a huge waste of an
Mhm,
appointment that
yeah.
someone could have had. So
Mhm,
it's very small problems like that, but
mhm.
lots of them.
I see. Thank
Yeah.
you.
If anyone wants to ask in Japanese, that is also okay.
日本語でも、質問してもいいですよってことです。ソニア先生、Can I ask one question?
Mm,
So, waiting period is very long, you said.
yeah.
If a patient wants to go to GP clinic,
Hmm.
then they don't have to wait so long.
No. So it depends on the clinic. So our clinic is the manager is very good. So she manages to so a lot of patients will get seen within 1 week. So
うん、
less than 1 week. Um, so our appointments are separated into emergency same day appointments, um, urgent appointments, and routine non-emergency appointments. So they when a patient writes, so actually I didn't mention in here, but online consultations are very so when a patient wants an appointment, they will go on the website and they fill out a form and they fill out a form with my problem. So I have back pain. I have back pain for 2 weeks. weeks, I have tried paracetamol or ibuprofen. And then we read every form and then we triage it to urgent, same day, urgent, or non-emergency. And then we book appointments based on that urgency. So for our clinic, you can get seen within 1 week, so less than 1 week. There are some clinics where maybe it will take 3 or 4 weeks because they're not very well organized. But then patients can register at a different GP if it's local.
Mm. But when you refer to hospital,
Mhm.
it takes several months. I see.
I mean, it is the bit that I dislike the most. So to get an
Mm,
ultrasound scan, it's
mm,
4 to 6 weeks.
ah,
And physiotherapy is
mm,
about 3 months.
mm,
To get see a specialist doctor in the hospital, 6 months to a year. To
mm.
get an operation, maybe 2 or 3 years.
Oh,
So
well, 3 years.
yeah.
Ah,
So obviously the hospital will triage as well. So the
mm,
urgent things get done urgently. And I think in the UK, the two things that we do really well are emergencies and cancer.
mm,
So these people will get operations straight away.
mm,
They will get treatment straight away. And I think those two things are done very well,
mhm.
but everything else is much slower.
I see. あの、大体皆さんわかりましたかね。まあ、日本よりもちょっとこう、待機期間がですね、やっぱ長いっていうことはあるんですけども、まあ、かなり、聞いたようにですね、こう GP クリニックでも90%の問題が、マネージされるっていうことですね。はい。他に、聞いてみたい方。遠慮しなくていいよ。日本語で。うん。はい。山田さん。はい。
Thank you for your lecture. And I want to ask that you said that medical students in UK,
Mhm.
50% become GPs. Is
Yes.
it きょ、義務ってなんて言いましたっけ？
compulsory, compulsory,
Mandatory.
mandatory.
So no, it's not. So when you finish medical school, you apply for your foundation years. So I think that's your shokikenshu. So you apply for 2 years in the same way. And then when you finish your foundation years, you apply for your speciality. Now you choose whichever speciality you want. So maybe you want to do OBGYN, maybe you want to do GP, maybe you want to do something else, but you apply at that point. GP is 3 years training, and the other specialities is about 7 years training. For example, maybe you train to be an OBGYN for 3 years, and then you realize you want to change to GP or you want to change, then you can do that too. So it's not mandatory, it's not compulsory. However, naturally, it tends to go like that. So, for example, I did surgery for 4 years. So I have colleagues who went directly into GP. And so they finished, when they finished and became a GP when they were about 30 years old. Whereas I did surgery first and then I went into general practice. So I was about 36 or 35 when I became a GP. And so you can change, but it's not mandatory. No one tells you you have to be a GP.
Thank you.
うん。まあ自然にそうなってるっていうのがね、日本からすると不思議な気もしますけど、まあ、医師の、まあ、ドクターマーケットがそんなにないっていうことで、アプライしようとするともう、GP のポストがいっぱいあるって感じで、 じゃあ GP になろうかなって、専門医から GP になるとかそういうのもね、あるみたいですね。うんはい。どうでしょうか。まあ、あと2、3分かな。あと1人ぐらい、もし、大人いたら。
Excuse me.
はい。お願い
Uh,
し
thank,
ます。
thank you for your presentation. I have one question.
Mhm.
In your presentation, you mentioned that a pharmacist
Mhm.
involved in transgender care and mental health.
Mm.
So, なんだろう。How does it provide
Provide the kind of care.
Kind of get,
そう、
yeah. So I love our pharmacist because because they are really good at managing medications. So they're very good at managing interactions of medications. They're really good at increasing, decreasing doses. Also, they're good at doing the blood tests to check that there is no damage from the medication. So I get to do the medical bit. And then once I decide they want to go on a medication, they can either come back to see me or they can see the pharmacist. So, for example, when I start antidepressants in a patient, I will always see them at 2 weeks and then maybe at 4 to 6 weeks just to check. And then maybe I'll see them every couple of months just to make sure that they're on the right dose, the mental health is okay. Because if their mental health gets worse, that's a medical problem. And so therefore I need to maybe call the mental health team or the psychologist. But once the patient has been on it for more than 6 months and they're happy, then the pharmacist will take over. And so the pharmacist can increase or decrease the dose, but it's not an emergency. There's no like worries about suicide. There's no worries about kind of an emergency happening. And if there is, they will ask me to see the patient urgently. And with transgender care, so interestingly, our practice is quite famous for its LGBTQ plus care. So when patients are referred to the transgender clinic, the waiting list is 3 to 4 years at the moment. So often we will do a lot of the management beforehand. So starting patients who want to become women on estrogen, patients who want to become men on testosterone, and then we have to measure their blood tests to make sure they've got the right amount of hormone. And the pharmacists will do all of that, actually. And they're very, very clever. They're very good, and they work independently as well. And sometimes the thing that I find really helpful is we have a lot of patients who come from abroad, so from other countries, from foreign countries, and they come with a medication list. And sometimes we don't have that medication available in the UK. So the pharmacists will look through the list and choose medications that are available in the UK at the equivalent dose. Now, for me to do that, it would take forever, but they will do it in their appointment. So sometimes, if they've got a long list, I will just book an appointment with a pharmacist and then get them done. They're amazing.
すごい。
日本より
Thank
も
you.
ね、やっぱ、コメディカルの人たちのこう能力が高いというか、
仕事の量。
いろんなね、ことを日本よりもやってる感じがしますね。
裁量が大きいですね、日本より。
ね、やっぱその辺がまあ、日本の法律がやっぱちょっと違うところがね、あるんでしょうね。
Because I think in Japan, it's the doctor at the top and everyone else underneath, isn't it? Yeah. I think we don't have enough doctors for that. We just, as I said, we need so many GPs. And then we got to a position where the GPs were so busy. So it's called task shifting. So you need to move some of those tasks to other disciplines.
タスクシフトっていうのね、日本でも今、医師の働き方改革で、 コメディカルにタスクシフトしていきましょうって言われてますけど、イギリスに比べるとやっぱそこまでタスクシフト、そこまでのっていうのはね、なかなか想像ができないですけど。
Mm. I think we also had a lot of resistance like 20 years ago when we were like, let's get the pharmacist involved. Like many GPs complained. Or I think I think many GPs said, oh no, that's too responsible. Or, or the doctors, we will lose our skills. Maybe we have, but it's been really incredible now.
なるほど。日本もね、どんどん変わっていきたいですね。
ですね。
Okay, じゃあ、ソニア
Okay.
先生、go to second part.
Yep. Next bit. So let's see if I can do this again. View slideshow. Okay. Fine. So the next bit that I want to talk about is culture. So one of the things I find really interesting working in London is culture. We see a lot of different cultures here. So to start, we need to describe what is a culture. So it's the learned and shared beliefs, values, norms, behaviors, and ways of interpreting experiences that are passed on within a group. So cultures it could be a country culture, it could be a prefecture culture, it could be a city culture, it could be a school or university culture, and you can have a work culture as well. So it's not unique to countries. So this can be defined by what we like to eat. So in the UK, Friday is fish day, we have fish and chips. And it's the languages we speak. So we speak English. The celebrations we enjoy. So in the UK, Christmas is our family holiday, not New Year. The stories that we tell each other, and also the clothes that we wear. So it rains a lot in the UK, so maybe we're wearing rain jackets. Famously, in the UK, we don't use umbrellas very much in the rain. So remember that culture is often invisible to the people inside it. So a bit like water to fish or air to humans, most people don't know what their culture is, but it shapes our behavior without conscious awareness. The time that we notice it is when you clash with another culture because that feels different to what you know. And as I said earlier, it can exist in a school or a university, a workplace, a region, or a country. So, for example, if you went to a different school to someone, you might start school at a different time, you might have a different lunch kind of regime, you might have different length of class, etc. And that is a culture. So I'm just going to give you a couple of my personal culture shocks. So as I said, sometimes you don't really understand your own culture until you meet someone else with a different culture. So I'm going to just explain something about time. So I'm Japanese and I'm also English, so I always arrive on time, maybe a few minutes early. I have a really good Turkish friend from Turkey. And he is always 30 minutes late, always. And in his culture, being late is very, very normal. So we had to have a conversation. And so now I don't arrive early, and he tries to arrive maybe 20 minutes late, but we have to accept that about each other. Another personal culture shock is personal space. So again, I think Britain, like the UK and Japan, we don't like to be touched by new people. But my Spanish friends love hugging and touching even the first time they meet someone. So the first time I met some of my Spanish friends, for example, my friend from Ibiza, I was a bit shocked about how much she wanted to hug me. And then eating. So again, my Spanish friends, they eat at 9 o'clock at night time. And my Australian friends eat very early at 6 p.m. So in the UK, we tend to eat around 7. But my Spanish friends went to a restaurant in Sydney at 9 p.m., which is very normal for them. and the restaurant closed at 10. So the waiters told my friends to eat very quickly. Another example is queuing. So obviously the UK and Japan, we're very good at queuing. But I've been to countries like China and India where it's not a queue, it's just the first person, the fastest person wins. So sometimes I find that very difficult as well. So why is culture important in medicine? So the culture is also a lens that we see the world through. So it's like the glasses that we wear. And it will affect things like how illness is understood, how decisions are made, how authority is perceived. And this is very important when it's a doctor-patient relationship, because doctors are seen as authority, and how communication happens as well. It can also affect our values. So what matters most to you? For example, people have different opinions about death and dying, and that could be related to your culture. So, for example, in some cultures, you cannot say the name of someone who has died, and so it clashes with a culture where that is normal. And then you have norms as well. So, norms is what is normal behavior. How do you book an appointment? How do you order your medications when you arrive in a country? Beliefs as well, what we think is true. So some patients might think vaccinations will harm my baby. That is a belief that is based on a culture. Maybe some of my patients are from countries where spirits are important. So maybe they feel that they are ill because their spirit is punishing them. And obviously, for religious people, they may think that it is something that God has done as well, that God works in mysterious ways. And specific to the doctor-patient relationship, as I said earlier, it can affect your roles and hierarchy, so your perception of authority. So, do you see your doctor as someone who is more important to you, or do you feel that they are an equal? So, in the UK, we talk to our patients as equals, so that's a flat hierarchy. But sometimes I get patients who come to see me who then find that quite difficult. They want me to make the decision for them. And this is important on how you make decisions together. And there's concepts of self as well. So Western cultures are very individualistic. Eastern cultures are more collective. So that means that in the West, the individual is more important, whereas in the East, the group is more important. An example is in Australia, in Aboriginal groups, when one person goes to hospital, the whole family will sit outside the hospital as well. So hospitals have had to learn to make grassy space outside the hospitals for families to sit. Language as well. So how you can express yourself depends on your language. So some languages don't have words for mental pain. This is quite common in countries like India or Bangladesh. So they will describe their depression as physical pain. And as a doctor, you need to understand that, if they say they have abdominal pain, that maybe you have to consider that they are in also some mental pain. So my medical culture shocks. So the reality. So in the UK, only patients can make decisions about their own health. So they will be told their diagnosis and their options, and only the patient can decide. My culture shock was that I found out that in Japan, the family can hide a cancer diagnosis from a patient. Like that cannot happen in the UK because the individual is more important. And in Japan, they were doing it because they wanted to be nice, kind to the patient. In the UK, you need permission from the patient to speak to another person about their health, including family. So what that means is that if the patient comes in, no, if the patient's wife comes in, and they want to talk about the patient's health, I cannot share anything to the wife without the permission of the patient. And we're worried about something called coercion, which means that someone is being manipulated in their decisions. But in many Asian cultures, so I used to work in an area with a lot of Bangladeshi patients. Sometimes the daughter or the son or the husband will call on behalf of a patient, and that was totally normal. And that was a culture shock. The other thing is that the treatment options in the UK are very conservative as well. We don't like lots of medications. We don't like big operations. We're very conservative. And I have a lot of patients from the US where I'm really shocked about how strong their medications are from such a young age. And that is definitely a culture shock for me. And then again, the impact of religion. So I am not religious. And so I never grew up with a concept of God or routines around religion. London, the places that I've worked in London have got a very strong Muslim population. And so I have to think about what they can have. So, for example, for my Muslim patients, because they practice halal, I have to make sure that the medications I prescribe them don't have gelatin in them. And also, they do Ramadan. So it's Ramadan at the moment, and the Muslim community fast, so they won't eat anything between again from daybreak to sunset. And so that's a huge effect on your medications. So we have to change the medications to twice a day regimens. So obviously, I don't expect you to know every single culture. That would just be impossible. But what I do really encourage is be respectful and curious and treat all the cultures the way you want your culture to be treated. I think especially in Japan, where it's a very Japanese society, it can be quite difficult to understand other cultures because they're so different. The really important thing is to listen first. So when someone shares about their culture, listen, and ask kindly. So for example, if someone says that I don't eat pork because I'm Muslim or Jewish, don't say, "Oh God, that's awful." You can ask something like, "Can you tell me more about this?" And don't judge as well. So instead of saying that's weird, try saying that's different. And adapt your decisions as well. Be flexible with your thinking. Just because your culture is normal to you, it's not normal to someone else. So someone else might be thinking that you're weird as well. And always remember that not everyone from the country is the same. So not all English people will like fish and chips. Don't make any assumptions as well. Don't think that just because they're English, they speak English, that they're from the USA. Maybe if they're not Japanese, maybe they don't speak English. You just don't know. You need to ask the questions, what languages do you speak? And as I said, you're not expected to know everyone's cultures, but you need to make sure that you do not look down at someone else's culture because it's different. And remember that every person's story is unique as well. So I think we're a more globalized world. So you have more people who have grown up in different cultures. So maybe they have a little bit of one culture, another a bit of a different culture as well. So how can you improve your cultural competence if this is something that's important to you? So first of all, make friends with people from different backgrounds as well, because the more you get to know people, the more you understand that we are very, very similar. We love in the same way, we hate in the same way, we get upset in the same way. It's just the lens that we see the world through is different. And learn a new language as well. So this is one of my favorite quotes, but it says, if someone is speaking to you in a foreign accent, they are smart enough to know two languages and brave enough to do their job in their second. So I think that's really important to know that if someone doesn't speak English, oh, sorry, for you guys, if someone doesn't speak Japanese, but they're trying, it means that they speak another language fluently. So, respect that. I'm sorry, I forgot to put another picture into this one. But my other advice is to go on holiday, see new cultures, see what's normal everywhere else. And I think that gives you a new appreciation for your home country as well. So travel with work or study or research doesn't really matter. So this is a picture of someone that I took in India, northern India. I've never seen a thyroid this big. I will never see a thyroid this big in the UK either. But it's given me a really good understanding of medicine and culture as well. And say yes more as well. The more opportunities you have, the more experiences you have. So this is a trip to the top of Mount Fuji. This is my friend Aoife from Ireland, and she asked me if I wanted to climb it, and I said yes. And it was a really great experience. So really difficult as well. So I think on that, I'm just gonna come out. And then I think we will go back into questions. Um, yeah, thank you.
Thank you very much. ここまでなんかこう、非常に多文化の能力をね、GP の先生が持って、普段からこう診療に活かしてるっていうのはね、素晴らしいですね。はい。じゃあ皆さんからどうでしょうか？質問など、聞きたいことがあったら。
Actually, I have a question for everyone. What cultures do you see
in Japan?
in Japan or in Tottori?
In Tottori. So East, East, Southern East,
Oh,
Asian patient like from Indonesia,
oh, nice.
Vietnam, sometimes Chinese patient,
Mhm.
かな。Maybe more metropolitan area, they have more variety of foreigners.
Mm.
But my cultural competence is not so high compared
It-
to you.
well, it's difficult. In Japan, it's difficult because it's 98% Japanese. Um, I think that's a really challenging thing.
はい。どうでしょうか？皆さんから質問、後半部分でも全体でもいいですけども、どうでしょうか？
一つ質問してもいいですか？
どうぞ。
こんにちは。島根大学の沼田と言います。Miss Sonia, thank you for the informative presentation. I'm from Shimane. It's a prefecture next to Tottori. Yes, and I was very interested in the GP culture, so GP system. So I participated here. I wanted to ask about the diversity in your in your um, in your medical working place, because you said in UK there's a very diversity in people. There must be a need for those people, people who can speak that language or know that culture. So I
Yeah.
thought maybe there's a big need for foreign doctors. So I wanted to ask how is your workplace diversity like?
Yeah, that's a good question. So, in my previous clinic, we had a lot of Bangladeshi patients. So we had two Bangladeshi doctors. They're UK trained, but their family are from Bangladesh. And we had one Bangladeshi nurse as well. And probably half of our receptionists were also from Bangladesh. Again, they were all born in the UK, but then they could speak Bengali. So it was a mixture at that place. But actually, my previous clinic, we used to have this woman called Rekha who would do all the translating. So she would be in the clinic. She would come with a patient. She would do the translating. but she would also do the cultural translation as well. So if I ask a question, she might say to me, like an example is I had a patient, a Bangladesh patient who was divorcing, and she was very upset because of the divorce. And I asked her, do you talk about it with your friends? Can you share and release this emotion? And Rekha, the translator, said, in our culture, we don't talk about a divorce until it's finished, which I didn't know. So therefore, like we had to change our plan so that we would see her more often. I got a psychologist to see her so that she could talk about it in a private space away from her culture. So you can do it that way as well. In our clinic at the moment, we have Richard out of the partners. Robbie is English, very English. Richard is he's from Burma but grew up in Hong Kong. So he speaks Cantonese. We have Chidi, who's the pharmacist partner, and she's Nigerian. So that's the top three. And then we have, going through the group, I would say one, two, three, four, probably about four or five very English doctors. Me. Um, I think that's now forgetting who's in my clinic. The nurses are Val's Indian, and then we've got Sandra and Cassie are also English. I say actually we were quite an English team, actually. On reception, we have Barbara who speaks English, French, and Spanish, which is very helpful.
Wow.
So yes, it's Yeah, it's quite different. I think Husna is from Pakistan, so she speaks Urdu. It's helpful. It's definitely helpful.
Wow. Thank you very much. It's very interesting hearing your country's story because in Japan we don't have much like doctors who can speak like other languages. So yeah, it's definitely difficult to like adapt and know like have like understand the patient like the foreign patient's needs. So yeah. And
Yeah.
to add, in Shimane, there's like a big Brazilian group.
Yep.
So yeah, so Brazilian people speak Portuguese, right? So
Yeah.
it's very difficult, but not many Japanese people. Me too. I don't speak post Portuguese, so it's difficult to like, yeah, adjust. Yeah.
Yeah. And it's interesting because so I don't speak Portuguese either. We have quite a big Brazilian population too. I do speak a little bit of Spanish though, and I think sometimes just showing that you care, I think is really important. Like I have a lot of Spanish patients who come and see me. They know my Spanish is really bad,
Yeah.
but they find it funny that I will ask them to sit down in Spanish or I will say, I will say something in Spanish just to make them feel more comfortable, and then we'll have a translator. So, but I think just showing that you make an effort can be enough to kind of break down some barriers. The other really interesting thing about sort of Spanish, kind of South American cultures, is that the doctor will happily hug the patient, which I find that very bizarre.
Yeah.
But I've had my Spanish friends tell me that a patient will start crying and they will hug the patient. And, there, I'm so sorry. And I
Yeah.
find that really shocking.
Oh.
Um, But my
Yeah.
friend also said that she uses the hug to then ask the patient to leave. So she hugs them and then takes them towards the door and then bye kind of thing, and then closes the door after them.
Yeah,
Thank you for the question.
はい、ありがとうございます。他にはどうでしょうか。面白いですね。医療従事者のドクターの方もいろんな国の人がいて、特にそのスペイン人のお医者さんの振る舞いはね、面白いですね、本当に。 なかなか日本ではね、やっぱりそのドクター側、医療者側のそこまでの多様性がないですからね。なんか話聞いてるだけで面白いですね。うん。他にはどうでしょう。あ、お
Can I
願い
have
します。
one?
はい。
You mentioned that don't make assumption. Oh,
Mhm.
I will question in Japanese so that other participant can ask you. その偏見とかを持たないっていうふうにおっしゃってたんですけど、その、でもみんな誰しもが、無意識のうちに、そういう考えを、持ち得るというか、持ってしまうことがあると思うんですけど、それをなるべくこう持たないようにするのに、先生が工夫していることはありますか？
Well, it's a good question. I think you need to ask a lot of questions. Like I give an example of don't make assumptions
うん、
is so in Islamic culture, so Muslim
うん、
culture, like you don't drink.
うん、
Like that's part of the religion. And I've had a couple of times where I've forgotten to ask that question
う
because
ん、
I've made the assumption that they're Muslim, they clearly don't drink.
うん、
But actually, they did drink. And
う
actually, a
ん、
lot of their problems was because of the alcohol.
うん、
And so I think it's just not to think, oh, just because you're Muslim, I'm not going to ask that question.
う
If you're
ん、
going to ask a Japanese person that question, ask them as well,
う
right?
ん、
So it's about not just taking someone just based on their culture or
う
what you
ん、
think you know about that
う
culture.
ん、I see. Thank
Mm.
you.
And sometimes you get it wrong as
う
well.
ん、
And I think this is really important about culture is that if you get it wrong, you get it wrong. It doesn't really matter,
う
right?
ん、
Most people, what they're looking for is that you're curious.
うん、
You might need to ask, you might have to say, I'm sorry, I didn't know, and
う
then that's
ん、
fine.
うん、
It's when you kind of look down on other cultures, that's when I think the negativity starts.
うん、I see. Thank you.
どうでしょうか。じゃあ、あの、アンケートでもらっていた質問にもちょっと行ってみましょうか。ちょっとじゃあシェアしますね。そうですね。奥谷さんが、いっぱい書いてくれてますけど、奥谷さん、喋ってみます日本語でもいいですけど。
あ、すいません。日本語でいいですか？
はい、日本語で、どうぞ。
すいません。先生、応援ありがとうございます。今、小松美優さんが聞いてくれたようなことと、同じようなことを聞きたかったので、なんか今の質問をしてくれたので、聞けてよかったなって思っていたんですけど、やっぱり日本で診療していると、外国の方、少ないので、やっぱりちょっと偏見だったりとか、そういう、医療スタッフの、視点っていうのが、あの、まあ、差別的な、ことを、直接言ったりとかするわけではないですけど、そういう表現だったり、あの、思い込みみたいな、ことが多いのかなと思っていて、で、そういうことがイギリス とか、ソニア先生の周りでも、あったりしますかっていうこととか、自分の中での、そういう、自分自身が、その、思い込みを持っていないかっていうことに気づけるようになるために、何かできることはどんなことがあるんでしょうというのを伺いたかったです。
Yeah, so there's a couple of things that I want to say. So number one is I think as a country, the UK works very hard towards racial equality, and there is a lot of racism here still. But I think there's more political movement towards racial equality. An example of times where I've found it really challenging is the the cultures I find really difficult are the very dramatic cultures. So maybe when they talk about their symptoms, they make it very extreme. Like, this is the worst pain ever. This is 10 out of 10 pain. I can't live like this anymore. Like, I really struggle with that because both Japanese and my British culture, we're very like restrained. Like, we're very kind of calm, and we hide our emotions. Whereas certain cultures, and often, again, like my sort of South American, South Asian cultures, it's like I'm gonna die from this cold, and things like that. So I think when things like that happen, you have to, and this goes with any patient, not just foreign patients, but even with like your own culture patients, you will meet patients that you don't like. And I think the really important thing is that you question, why do I not like them? Because there will be something in you that triggers this, right? And so, for example, I know that I don't like that culture because my cultures are different, right? And therefore, it makes it easier to understand why I have this negative emotion. But for example, I might have someone like a man who's very much like, you're a female doctor, you don't know anything. And I hate that, but then that's maybe something inside me where I've worked in very male environments. But again, that's my problem, not the patient's problem, right? So there is like I think it's called transference, I can't remember, but there's a cycle that, a patient will bring out a negative emotion in you. You need to question why you have that negative emotion, and then you need to figure out how you're going to fix that problem because it will be a problem within yourself, not with the patient.
はい。ありがとうございます。あの、苦手な患者っていうね、そういうのも重要だって話で、陰性感情を抱いちゃうときに、この患者苦手だな、嫌だなって思うときに、自分の中にその文化の差っていうか、自分の中に何かがあってっていう、そこに気づけるチャンスだっていうことで、相手に問題があるっていうよりは、こう自分の中のそういう課題に気づいていけばいいっていうね、そういう話ですね。
あり
Thank
が
you
とうござい
very
ます。
much. うん
ございます。ちょっと、もう一つ
はい。
伺いたいんで
もう一つ。
すけど、
はい。
すいません。
どうぞどうぞ。うん。
あの、最初の方の講演でお話ししてくださったソーシャルプレスクライビングっていうのが外来の中にあったんですけど、あの、結構私が思っていた、日本で言われているような、社会的処方という言葉で日本では言われてるんですけど、あの、それよりももっと経済的なところだったりとか、結構具体的な問題に対処しているっていうふうに思ったんですけど、あの、でもそれを、外来を予約して患者さんが、あの、自ら、予約して来られるのか、それとも、他の職種が、必要だと思ったときに、例えばドクターやナースが、あの、紹介することが多いのか、それとも患者さんが自分自身から、 そのソーシャルプレスクライブが自分が必要だというふうに考えて予約を取って来られるのか、どうなんですかっていうのをちょっと伺ってみたいです。
So normally the patient will come to the doctor because when a patient comes to a doctor, they're often in distress or they're in pain, either mental or physical pain. And I say that the most important job I have is not to diagnose and give medications, but it's actually to sit with someone during their pain. And often when you kind of unpick the little bits of that pain, you'll realize that there's a lot of problems. Some of it is medical, but some of it is social. And so therefore I'll take the medical bits and I'll give the social bits back to our social prescriber. So normally I would put them on the list for Jacqueline to deal with. But yeah, I think it's a really important notion to remember that as doctors, it's not just the medicine that we're doing, we're also being people as well.
うん、ありがとうございます。で、
だい
どっちかとい
ぶ、
うと、こう、多分、予約を患者さん自身で取るっていうよりも、こう、医師とかがこう必要だと思った方をソーシャルプレスクライビング外来につなぐっていう
うん、
イメージなのかなと思います。
Yes, yeah.
うん。すごい、日本でも社会的処方を少し取り組みが始まってるんですけど、医師との、ドクターとのまだ連携が非常に弱くて、まあ、どちらかというと、コミュニティワーカーって感じでやってるんで、やっぱその GP クリニックにそうやって連携しているっていうのはすごいですね。うん。はい。ありがとうございます。うんじゃあ、ちょっと次の、そうですね。山田さんがいっぱい書いてくれてるけど、なんかあの特にこれ聞きたいってやつあります。うん。
昨日、すみません、日本語で、さっきの話の続きで、その一番最後の質問で、その自然に50%になるって
うん。
言われてたんですけど、その GP の数的には足りているような状況なんですか？
うん。
No. Mainly because um, GP isn't seen as an attractive profession. Um, because I think when people leave medical school, they're like, yeah, I want to be a neurosurgeon, or like they want to do the kind of more exciting things. And so I think there's a real culture issue where a lot of hospital doctors will be quite rude about GPs as well. And there is work being done to try to improve that. So I think generally when people leave kind of medical school, when they do their like shokikenshu, like they have a very negative image of general practice. And actually, even myself, until I started doing it, I didn't think it was that great either. So I would say that we don't have enough trainees coming through. In the UK at the moment, we're having a very big problem with jobs. I don't really understand it, but they've created too many medical schools, not enough jobs. So actually, people who are graduating don't always have a training job. We're having a few strikes at the moment because of that. And it's very, very difficult to get a training job as well at the moment. So, and this is all very new in the last few years. So I don't really know what's happening. But I mean, certainly we always need more GPs, I think.
ありがとうございます。やっぱり、今日本ではまだまだ GP は少ないんですけど、やっぱり、この GP っていうのは、ちょっとその専門領域が、明確でははっきりしないような、科になってしまうので、やっぱり日本でもその専門領域を持つ人からは、ネガティブな、 言葉を受けたりすることもあるんですけど、やっぱりイギリスでもそういうふうなイメージがあるんだなっていうのが分かりました。ありがとうござい
So
ます。
we've had general practice in the UK for 75 years and we still have the same problem.
やっぱりイギリスは戦後すぐ GP 制度が立ち上がりましたんでね、第二次大戦後に。だからまあ世界に先駆けてっていうところはね、ある。まあそれでもやっぱ制度的な問題はあるっていうね、ことですね。日本はまだonly 3% is
Wow.
GP, certified GP うんで、はい。じゃあですね、次は、そうですね。うん。久保田先生、久保田先生います？
はい、います。
どうも、お
こんに
久しぶりで
ちは。
す。こん
お久しぶ
にちは。
りです。ありがとうござ
うん。
います。
どうでしょう。こういう質問してくれてますけど。うん。
はい。本当にお話を聞いてですね、今、I live in Scotland, in
Oh, do
Glasgow
you?
now. Yes. As
Oh, no way.
just a, yeah, just a family, with family. I'm not working here,
Yeah,
Yeah, so I feel dialectory diversity just living here because
yeah.
many people, yeah, from many different cultures. But yeah, in Japan, to feel different cultures is so difficult, I think.
Mm,
Yeah, you said, yeah. So how to feel diversity of culture and personality then? How to training, yeah, is yeah big question for me. Yeah,
mm.
so in the UK GP training program, uh, you do you have any training program to improve culture competency or something?
No, we don't actually. I
Mhm,
think that the thing that I really encourage is to go abroad, do exchange programs, maybe do research abroad, work abroad. Um, I remember when I went to Paris and my French is not good. And I remember just trying to change my mobile phone SIM card,
mhm. Yeah.
and the 18-year-old shop assistant started shouting at me in French
Mhm,
because I didn't know what I was doing.
mhm,
And I still have that in my memory. So whenever I speak to anyone in English
mhm,
who English isn't a first language, I
mhm,
have that memory of being shouted at by the shop assistant. So I try to be really nice. And if they don't
mhm,
understand me, I will try to explain it a different way, but I won't shout at them.
mhm,
And I think the more experiences we have of how different we all are, but how similar we are, I
mhm,
think actually that's what breeds cultural sensitivity.
mhm.
And I think learning a language is really good because
Yeah.
you can see how languages represent that
Yeah.
culture.
Yeah.
So, for example, German from
Mhm,
Germany, it's you have to know how the sentence finishes before you
mhm,
start the sentence. And I find
mhm,
that very German, like very organized. Um, but like in English, in British English, we
mhm.
just keep talking with
Yeah.
no structure. So I find that very English. I think in Japanese, you never say anything. You just sort of have gaps in your language, and then you make your assumptions. I think it really represents a culture,
Mhm,
how you speak, the language itself. So I think if you're interested in cultivating cultural diversity, it's definitely about mixing with different cultures. It's about going abroad, traveling, doing work, research, things like that, and then learning a language as well.
ありがとうございます。
はい。
そうか、久保田さん今スコットランドなんですね。
はい、そうなんです。はい。なんか住んでるともうなんか
すごく感じるので、これはもうなんか文化的能力を養わざるを得ないというかなんですけど、日本に住んでいる GP がそれが必要だって思うことにまずステップが必要で、必要だと思った時にどうやってトレーニングするかがまたなんかこうハードルとしてあるんだなっていうのがすごく今どうしたらいいかな、日本に帰ったら何しようかなと思っているところです。はい。
素晴らしいですね。はい。じゃあ、あと、5分ぐらいになってきましたけど、あと1問ぐらいですね。もし、声上げて質問したい人いれば受け付けますけど、どうでしょう。リサさんが手を挙げてますか？
Hi, it's Reese. I'm sorry. It's no pictures because I've got a bit of cold and it's actually I'm in the bed. Thank you very much for the talk and this one actually one of my senior doctor introduced this meeting to me. I actually got MRCGP last year in the UK in Sheffield.
Oh, congratulations.
Thank you. I graduated in Japan and I worked in NHS for about, during the COVID as well, so more than 5 years. And actually I've got, lots of cultural differences, NHS difficulties. And this topic might be different from your topic today, but you told you work in the NHS for 2 days and in private sector for 1 day.
Yeah.
Do you see any differences between NHS and private? Like, for example, prescribing? And I feel, and then I started working back in Japan for only about 2 months now. And then every time I see a difference between the UK practice and Japan. So I feel that Japanese medicine is more like a service. So the patients want, but they can want treatment. They can want, the specialist treatment, which in Britain it would take months and probably years. They can have the MRI maybe in a week time and then paying about 30% because it was covered by the insurance in Japan. But it is really different. But what do you see the difference between NHS medicine and the private sectors, and what do you think the NHS medicine might be,
Yeah, so it's really interesting you ask that. It's really because the first thing about the private sector is you have to dress better. I find that in the NHS, I can turn up in my trainers and maybe just a jumper. But when I go into the private sector, I have to brush my hair, I have to do my makeup because you're presenting yourself as a brand. I think the thing with the NHS is because your patients are registered at your clinic, you can have some very difficult conversations with them. You can also have arguments with them as well. So they will come to you, they want something, it's not appropriate. You can say no, because it's for the best for the patient. And they can see another doctor in the clinic if they don't like me. If they really hate the whole clinic, they can go to a different clinic and register somewhere else. But ultimately, it's kind of they can't do the doctor shopping that you do in Japan. So you can't just go from one doctor to the next doctor to the next doctor until you find the right treatment. In the private sector, so I'm pretty new to the private sector, I do find that, there will always be a proportion of patients who are, whatever you say, whatever you do, they don't like you. So I think you just have to let go of that small percentage of patients. But I think the vast majority of people, they still respect you as a doctor, and you just need to explain why you're doing this as well. And patients come to you because they like you, and kind of the way that you approach things. So, for example, this is actually my NHS clinic, but I'm going away to Japan for 3 weeks. I've got a few patients that will need to be seen whilst I'm away. And I've always asked them, do you like someone who's like nice and soft and fluffy, or do you want someone who's like direct and, tell you how it is? and matter of fact. And it's really interesting because my patients will ask for different things. So for my patients who've asked for the soft and fluffy ones, I've booked in with that particular doctor. And the ones that want to have a direct doctor, I've booked with that doctor. But ultimately, like these patients in the private sector, they come to you because they like you. And so I think it's okay to show your personality a little bit more. Like in the private sector, they know that I don't like prescribing medications. If you want if you want to have antibiotics for every cold, go to someone else. But I will talk to you about sleeping, lifestyle, eating, exercise. I'll give you your options. I'm pretty open-minded. If you want that, then come to me. Yeah, so I think I don't really know. I've not worked in Japan, so I don't know kind of how much say you have in that. But I do know that whenever I've looked at Japanese medications, I don't understand any of them. So it's congratulations for managing that transition.
Thank you very much. Yeah, it's very different. I think in Japan we do tend to use more neuro medication. So I'm so surprised that allopurinol is kind of like for example for a gout, the allopurinol, the first one to prescribe, we don't the Japanese doctor don't prescribe in Japan. So it's really different, and especially for like high blood pressure, start from not start from ACE or ARB. We just ARB first, no ANZ inhibitor in Japan because of the cough. I don't know. So it's really different, but yeah. And thank you very much for the talk between.
And also you got to remember, and this is like cultural things, but our guidelines are based on white English people. So guidelines do change across the world because it's appropriate for that culture.
That's a good point. Thank you. Thanks for your time.
はい、ありがとうございます。そろそろじゃあ、ソニア先生が時間、もう行かなきゃいけない時間だと思いますので、非常に、リッチなですね、90分、本当に感謝したいと思います。ソニア先生、今日はありがとうございました。
ありがとうございます。とても楽しかったです。
もう素晴らしいレクチャーの Q&A も素晴らしかったです。じゃあ、皆さんこれで終わりたいと思います。今日はじゃあどうもありがとうございました。はい、失礼します。